Welcome, Anne. I'm absolutely delighted that you've come to talk to us. I know you've been, as a physiotherapist, working with women for many years, postnatally after they've had children. And so I think that's great that you've come along to sort of reassure people and give us the lowdown really on what happens when you've had a baby, physically what happens to you and what you need to do to recover and speed up the recovery. So the first question I'd like to ask really is whether Pilates is a good thing to do or not.
Definitely. Pilates is such a gentle way of exercising, then it's very suitable for women who've recently had a baby. And because it targets specifically pelvic floor muscles and the lower abdominal muscles, which are the two muscle groups that you really want to be working, they're the ones that have been affected by the pregnancy and then by birth. So definitely a good way of exercising.
Okay, so at least people can feel reassured that it's an okay thing to do and it's a safe form of exercise if they've had a normal pregnancy really and birth.
Certainly, and if they've had a cesarean section as well as a normal vaginal birth.
Okay, so how soon after somebody's had a baby can they start to do Pilates kind of exercises?
Virtually straight away. We would advise women who've had vaginal birth to start doing pelvic floor exercises virtually the day they've had the baby, and certainly the day after they could start doing gentle exercise and working the abdominal muscles as well. If somebody's had a cesarean section, then they might feel they want to wait slightly longer. There's no reason why they should avoid exercising, but they may want to wait just a day or two if they feel a little bit of discomfort from around the wound and the stitches.
Okay, so that's more to do with the soreness of being cut than the fact that they perhaps can't exercise because they've had a section and it's different somehow.
Yeah,
it's just
no,
soreness
having a cesarean doesn't stop you from exercising.
Okay, that's good news. So tell us about the pelvic floor then. You've mentioned that a few times. What is it and why is it so important?
Okay, well I've got a model to show you.
All right.
This model of a pelvic floor.
Yes.
If you imagine the pelvis, and here we have the pelvic floor underneath.
Okay.
And it shows how we've got the front passage controlling the urine from the bladder, the urethra, vagina in the middle, and then the back passage from the bowels controlling the movement there. And you imagine if you've had a vaginal birth how far that muscle has to stretch during the birth itself. But that muscle's weakened by pregnancy as well and by the extra weight that a woman's carrying around. So the weight of the baby pressing down during pregnancy itself weakens the muscle, and also hormonal changes. And if the pelvic floor remains weak after you've had a baby, then it could mean there's some problem controlling the bladder, stress incontinence, such as leaking urine with coughing or sneezing, which can be very common, or difficulty controlling the bowels either.
Right.
And the one thing probably women don't always realise is the control around the vagina. So some women find that when their periods start again with their monthly cycle, then actually retaining a tampon could be difficult if the pelvic floor is weak. And finally, pelvic floor muscles are important for sexual function as well, so another good reason to be doing pelvic floor exercises.
Okay, so the pelvic floor exercises that you advise women to do, what kind of things do you tell them to do?
Well, I'd start by explaining the easiest way to think about your pelvic floor muscle is imagine trying to tighten around your front passage as if you're stopping yourself from passing water, stopping yourself having a wee, and imagine tightening around the back passage as if you were stopping yourself passing wind or a bowel movement, and feeling as though the muscle is tightening inside, and then you should feel a gentle lift up internally.
Okay, and if a woman has been stretched a lot or has had perhaps problems before even the pregnancy in that area, and they can't feel it, what should they do then? Just keep going?
They really need to keep trying. It's not unusual immediately after giving birth not to feel very much happening at all. Even if you were aware of a strong pelvic floor contraction during pregnancy or pre-pregnancy, the first day or two after you've had a baby, you can try very hard and feel very little happening. But the main thing is to keep persevering with that and not give up.
Okay, so it could be that there is movement, it's just that you can't feel it.
Yeah, because of the swelling or a little bit of pain around the area, obviously, then it does feel a little bit numb. So it may be happening even though you don't feel it, so it's important to keep trying.
Right. So I guess the message is with the pelvic floor, do them regularly and keep going with them.
Certainly, and if problems continue, then they may need to seek some help.
Okay, that's great. Thanks for that. A bit gruesome.
Okay, well we'll put that away then.
Okay.
The biggest difference Pilates has given me after having Lucy was my pelvic floor and my stomach muscles were a lot stronger. So it's meant that I can do a lot more much quicker than after having Edward.
And also it's helped with my upper body strength as well, and I think in general my stamina and my energy levels really as well, because I think it builds your strength up in general, which just helps you in day-to-day life.
Tell us a bit more about the logistics really of having had a baby and lifting them and carrying them, and what do they need to look out for?
Well, a lot of women find that they start with backache after they've had a baby. Backache's very common during pregnancy, but people expect that to disappear really once you're not carrying the weight round inside. But lifting and carrying a baby and all the new activities that a mum's carrying out, all the bending and lifting, do mean that you're putting your body under a lot of strain, and backache can be quite common. So it's very important to think about how you're moving and lifting and how you're carrying your baby.
So what kind of things should a woman, I mean, obviously be aware of it and careful with lifting and carrying, but how should they be holding their baby, and what tips do you give people?
Well, I think the important thing is when you're lifting the baby to be careful to avoid twisting at the same time as lifting.
Okay.
And being aware when you're lifting the baby, particularly if you're lifting them out of a car seat or off a mimosas basket that may be on the floor, or picking them up from the floor to standing up, not to just bend over, but to actually kneel down.
Okay.
Perhaps have one knee bent, pick the baby up, hold the baby close to you as you come up into a standing position.
So why do you need to hold them in close? What does that change?
The closer you hold the baby to yourself, the less strain and less pressure you're putting onto your back. If you're holding a weight at arm's length, then you put much more strain on your back, so you want the weight that you're lifting, be it your baby or other things that you're lifting for the baby, should be close to you.
Okay, so that includes car seats and buggies and all the rest of it.
All those are the things that women are carrying around when they've just had a baby, yeah.
Okay, so I guess that's going to be even more important as the baby gets bigger, because obviously, you've carried a few pounds around inside, and then they're getting bigger and bigger over the months, and by the time they're a year, you're still doing a lot of carrying.
Women are still carrying babies around when they're toddlers.
Yes.
Because
I know this.
even when they get to the stage where they're walking, there are times when they're tired, they still want picking up, they want lifting, they want carrying upstairs to bed.
Yeah.
And the other thing to be careful about as they're getting older is the temptation is to carry a baby around on your hip on one side.
Right.
And if you're tempted to do that, then certainly make sure that it's not always the same side you carry the baby on, but alternating sides. But ideally you want to carry them from in front so that the weight's carried centrally.
So the kind of carry pouches would be quite good for that when they're tiny, and as they get bigger, I guess put their legs around so that they're like a koala bear sort of.
Yeah, holding on in that position rather than just on one side, because you tend to stand very awkwardly with the weight to one side and put all the strain through one side of the hip.
It's certainly something in class when I've been with women who've got children, they favour one side a lot, and they don't realise it until you sort of point it out to them, and they sort of get much stronger on one side of their back than their other, and end up with sort of niggles, in either the lower back or even sometimes the shoulders and the neck from carrying, and one bicep stronger than the other.
And being very lopsided. And the way you carry a car seat, that's often the same thing, that people tend to always carry a baby in a car seat to one side.
Okay.
And carrying car seats around is not good to be doing all the time. Obviously, short distances, but generally it'd be better to be using the buggy or the pram to push the baby around in rather than just carrying them in a car seat.
Yeah.